And so that's sort of,
Sorry, I forgot that.
oh, do we need to restart?
Yeah, let's restart again.
Perfect.
All right, ladies and gentlemen, welcome to my podcast, which is another episode of Make a Change. And let's introduce Michelle. So, Michelle has recently uh, qualified to become a peptide performance coach. And
Mhm.
yeah, we were just about to introduce her when I remembered I have to record this.
We have to record.
And yeah, so Michelle, introduce yourself. What is your background? Your
Hello, thank you so much. I'm so excited to be here. So I'm Michelle.Kilduff. I started off in the industry, like many people, as a certified personal trainer. I mean, it's kind of a gray area because it was during COVID. Like 2019, 2020 is sort of when I started to take this passion from of fitness to a profession. And naturally, of course, what goes hand in hand with personal training and fitness and overall health is the nutrition side. And so I happen to fall in love with that aspect of that industry and the space. At which point I became a certified nutrition specialist. I've gone through a few different certifications, and so for probably 4 or 5 years, that has been my primary focus is a lifestyle coach. That I really take pride on putting emphasis on habit and behavior based coaching
Mhm.
so that individuals can just learn and not be told what to do. It's very easy to give macros in a training plan, but it's to really break through some of those limiting beliefs or behaviors in order to create long-lasting results.
Yeah, awesome. And what made you to be specialized in a peptide performance coach?
So, you know what? It's been a long time coming. And I mean, you're in the industry, so I'm sure you remember. It's like, where was I when all of a sudden GLP-1s exploded, right? And being a professional in the industry, naturally, most people were like, "Ooh, okay, what's going on here? What is this miracle drug that all of a sudden is popping up everywhere? Is it a threat to us? Is it a risk? What are like, are there any actual health benefits, or is this just another like get like a quick fix, right?" And I have always felt that a coach or a trainer or whatever your profession is in the industry, if you operate in absolutes, you're probably not that great at your job. So I'm never like, you can't have this, you have to do that. And
Yeah.
so I took a step back. Rather than feeling threatened by GLP-1s, I was like, okay, how is this different? What needs to be done? Who are these for? And I really wanted to become educated. I didn't want to be another one of those nutrition coaches that were like, oh no, that's the easy
Yeah.
way out. Oh no, and I really started to do a deep dive. And I'm like, you know what? This isn't actually that bad. Especially when you factor in that it isn't a quick fix. It's not an easy out. That's just the misconception.
Okay.
From there, I naturally progressed into peptides in general. I've actually been aligned with a team of physicians in the United States for almost 2 years, I would say,
Oh, wow.
where it's not just GLP-1 focused, they're actually peptide focused in general. So that's where my knowledge base kind of went from just GLP-1s and weight loss to the pool of peptides. And so I am essentially their peptide lifestyle coach for patients.
Yeah.
And and here we are.
Awesome. Interesting. Cool. Yeah, when I first heard of it, I didn't really know what it is.
Mhm.
And yeah, I read more about it, and I thought, okay, at the beginning, I thought, so, oh, maybe people using it or misusing it just to lose
Mhm.
weight.
Mhm.
But then they're popping so many other peptides, what you just said. There are so many different peptides. They're helping with sleep, with recovery, with immune
100%.
system, so many things.
Mhm.
So, and I thought,
Yeah.
so maybe I'm judging it a little bit too quickly. And
Yeah.
yeah,
Exactly.
and can
Yeah.
maybe
No.
help the one or the other person.
Yeah,
Mm.
and I think the more we become educated, especially as coaches and professionals in the space, the more we can lean into it. I think one of the biggest things that I didn't want to poo-poo something like a GLP-1 was because people are going to do it with or without us. I would rather someone do it with me, even if they don't meet the criteria of someone, a candidate who should be on it, because at least I know that they're doing it in a safe way. They have someone in their corner, someone helping them and guiding them, because I have seen far too many instances of what can happen when the patient or the user has free range of doing whatever they want with these peptides and GLP-1s. So I'm like, you know what? They're going to do it regardless. And I may as well be involved to help them. And that's really, I think, where the evolution of the coaching is going, I think.
Yeah, yeah, absolutely. So, and has your audience changed now somewhat?
You
Or
know what? It is and it isn't. I mean, it definitely is a transition. I still do lifestyle coaching, absolutely. I haven't fully cut that out. Certainly, I've gotten a lot of people very curious, and it's funny because I kind of transitioned into peptide performance coaching right before the industry trends like exploded. And so I was like, oh, now I'm going to kind of look like I'm fitting in with some of these like wellness influencers that are
Mhm.
pushing like their gray market peptides with affiliate codes. But you know what? I actually am just gonna stand on my position where it's like, no, I'm about educating, and I
Yeah.
have found that because the industry has become very quickly saturated about the buzz on peptides, I'm having a lot more people coming to me and being like, oh, she actually understands a bit more about what they are and who to go, what supplier to go through, or pharmacy to go through,
Yeah.
those types of things. So the
Okay.
audience is slowly shifting for sure. Still, the most popular demographic in terms of peptide use are the GLP-1s.
Yeah.
Those are the most easily accessible at this point. But yeah, it's been a really interesting, cool transition.
Cool. So, what is actually a peptide?
Like the $1 million question, right?
Yeah.
So essentially, they are short chains of amino acids, and they are the communicators on a cellular level.
Okay.
And there's like thousands. Like our body produces them naturally. So this isn't some foreign, it's not a steroid, it's nothing like that. And I feel like that is something that needs to have an emphasis put on it, is that peptides have been in the bodybuilding industry for a very long time. So there is a stigma that it is kind of lumped in with steroids and performance enhancing drugs.
Yeah.
But in fact, it is two separate, it's very different. And so peptides, like I said, we produce those naturally in our body. It's literally how our body communicates on a cellular level to do things like lose weight, build muscle,
Mhm.
sleep, recovery, collagen production. Like anything and everything. So, yeah, that's basically them in like a nutshell.
Yeah. Okay, cool. So, what is your professional opinion in terms of, because there's often a talk about that
hmm
people who are on Ozempic or Mounjaro, so these are
hmm
the two ones that are on the market at the moment,
Yeah.
so that they're losing the weight,
hmm
but do they actually lose really body fat, or do they lose a lot of their lean body mass as well? And how
You know
do you
what?
navigate that, like from a
Yeah,
nutrition point of view?
totally.
Yeah.
Yeah, and unfortunately, when it's being misused or misprescribed, it is a lot of lean tissue. And I mean, we've seen that evolve and occur by the general population through like even like Ozempic face, like all of these kind of um, results of that. And it is basically stemmed from, like I said, improper prescribing and then just sort of being left to your own devices a bit and not enough education. And I don't want to say that physicians it's not their job to ensure that a lifestyle is maintained. That's not actually part of a physician or a prescriber's job. It's to make sure that this person can take them and they give them a starting range, but it's not their job to hold their hand in terms of eating enough food or training properly or recovering properly. And so I feel like that isn't one of the big reasons why I wanted to enter this industry, is because there is a gap. And what we're seeing, if people aren't educated and there isn't someone helping from prescription to results, it is that lean tissue loss.
Yeah.
A lot of people will just um, give themselves an increase in dosage, and it's becoming a little bit more frivolous in terms of um, it's still a drug. We still need to take this
Yeah.
seriously, even though it is something that we naturally produce. We can't just be like more is better.
Yeah.
And so it's really educating people on what actually has to happen after you have been prescribed.
Yeah, absolutely. So when you take, what is, when you start working with someone and that person
Mhm.
is, what I understand, it gets referred from a medical provider,
Yep.
and then you start working with them, but
Mhm.
your job is the nutritional side of things.
Yes. Yep.
So, what do you see are often red flags? Like, what do you address first? What is important
Yeah.
for them to know? Like,
Hmm.
basically, like a non-negotiable.
Yeah, absolutely. And I mean, oh, there are so many red flags. I mean, ideally for me, I take clients or patients who are referred by physicians, or if as long as they're prescribed it, those are the individuals I will take. Best case scenario,
Mhm.
I take those clients on before they actually start the medication so that I can really figure out what the current situation is. What are we actually working with? Because if we don't have the foundation in place in terms of like protein intake, a relatively balanced diet, regular exercise to some degree, taking a peptide or a GLP-1 is going to exasperate that. It's going to make those things that we aren't hitting even more extreme. So ideally, I even for a couple of weeks, I really like to take people on so that I can like, how much are you eating? How much protein are you having? Are you timing it throughout the day? What does your training look like? So that I can figure out like, yeah, where's our starting point? Because if you're already under feeding or not eating enough protein, well, guess what? It's going to get worse. So it's really important to make sure that we have some level of understanding and awareness before our appetite is all of a sudden gone. So those are the huge initial factors. But if I work with somebody who's already started, I will still almost do like a baseline tracking in terms of seeing where they're currently at with the GLP-1.
Yeah.
Because some people can eat an okay amount, but oftentimes if someone isn't educated that they in fact still have to eat, it might be like 900 calories or less. So I still need to see what the current
Mhm.
situation is, and then I'll decide like, hey, what do we want to tackle first here to really make sure that we're not like trashing your metabolism.
Do you have like a protocol or something? Because so that GLP-1 is like highly suppressing your appetite.
Big time, yeah.
So I believe that made it so famous for a weight loss drug, I believe, because it takes all that food noise away.
Exactly.
But
Yeah.
what I can imagine is like, because if you eat protein, like your chicken breast, your meat, all these kind of things, that like fills you up really quickly. So
Yeah.
do you see a trend that maybe that protein intake goes lower while they're
Hmm.
on that drug because of that, because it's so filling? And how would
Yes.
you
And
navigate them to kind of still prioritizing them without feeling nauseous or something?
exactly. It can be really tough for certain individuals, especially depending on where they were before they started GLP-1s. The number one misconception is that if you take a GLP-1, you don't have to worry about food because it's no longer like your appetite is managed, but in reality, it's the exact opposite. You have to actually be more adherent to your tracking. You actually have to be more aware of what you're eating because you have to force yourself to eat. And so, in terms of a protocol, it's basically you might have to force yourself, and it's eating a lot of smaller meals,
Yeah.
definitely being protein forward, but because it's obviously appetite suppressing, depending on the dosage, that's why it's really, in my personal opinion, I'm not a prescribing physician. I always think it's best to start at that base dosage or a microdose
Yeah.
because again, less isn't more, but if you were to jump out the gate after a couple of weeks and jack up your dose, it's going to make it even worse. You are going to have zero appetite, zero desire. You have to still eat.
Yeah.
And so it's those small meals. throughout the day. And it's not even necessarily like protein is a big one because I mean, think of when you're sick and you're like, okay, I have to eat. Well, our bodies don't gravitate to protein per se. Usually it's like some type of comfort food, right? So it's hard, but in general, all food is kind of like meh,
Yeah.
especially if you're dosing too high. I mean, I had a client who came to me and she had zero appetite, like nothing. And
Mm.
the only time that she would have a little bit of an appetite was in the evening, but the only thing that was palatable was candy and chocolate. So that's all
Mm.
she ate for the
Yeah.
entire day. And it's just like that breaks my heart. And it's like your dose is too high. You have to be able to manage whole food. Your body is literally going to start shutting down here. And so yeah, it's the reality check that, yeah, okay, we actually still have to eat food, but it also isn't going to necessarily look like these big three main meals. Like it's really important to just have small meals
Yeah.
consistently through the day that are well balanced.
Yeah. Actually, now I just remembered one of my clients, she got put on Mounjaro.
Okay.
She actually never wanted it. Her doctor prescribed it to her, but not
Oh,
necessarily for the reason of weight loss, just really
okay.
to treat diabetes.
Okay. Yeah.
So, and she told me about it because
Mhm.
we have a really good relationship. And I told her, so look, I do read a lot about it, but doesn't make me an expert. So I do
Hmm.
not know what they do or how they react. But
Yes.
what I recommended is like because she has a good foundation of nutrition. She knows how to track.
Good.
So I thought, so keep tracking your nutrition, prioritize protein, like the basics, stick to those.
Hmm.
And she
Hmm.
came to me as well, like, so Kate, all I'm eating is custard.
Yes. Right.
Oh, and
Oh,
she was actually really angry with herself. I was like, I can't
yeah.
help it. I'm like zero appetite.
Hmm.
So we
Yeah.
found a easy fix because here in Australia there is like a brand, it's called Wicked Sisters, and they're like high
Okay.
protein puddings.
Nice.
So they're
Okay.
actually really yum. So I thought, so maybe
Good.
change that, maybe that works.
Yeah,
Yeah.
just to get something. And I mean, it that is a very common theme, and it's really, really it's sad that that's not more commonly spoke about, that like you actually naturally will just gravitate to some of these really not ideal foods that are they're okay in moderation when you're eating a balanced diet, but when you're just trying to survive on this sugar because it's the only thing that is mildly palatable. Because with GLP-1s, not only does it reduces that food noise and obviously reduces hunger, but like you don't even have satisfaction. There's just no desire. It's just it doesn't exist. And like for some individuals, medically, that is what it takes. But there is like a really not so great side to them if you're not aware that that's going to happen.
Okay, cool. So we already talked a little bit of the downsides of it, but you
Mhm.
mentioned at the beginning that it is not an easy way out.
No.
But do people misuse it as an easy way out? What is your experience?
Yeah, I think that we definitely went through a window of time where it was like, oh my gosh, this is all it takes. I can lose weight. So it started off as like a medication for obesity. I mean, obviously for diabetes, but then transitioned to obesity.
Yeah.
And there were specific parameters in terms of like body fat percentage and prerequisites, so to speak. And then it became more regulated or sorry, not regulated. It became more like common for anybody really, and especially with the access of not even necessarily having to go to your physician or getting blood work through gray market peptides. It definitely went through this space of like, oh, I'm just going to do this instead. I'm just going to take a GLP-1. And again, people don't realize like you can't just jump in and jump out, or you shouldn't anyways.
Yeah.
And so it really did explode in terms of it being an easy, people treating it like an easy way out. But the reality is, like I said, you have to work so much harder. In order to make sure if you actually care about your metabolism and your overall health, your lean tissue, your cognitive function and recovery, you have to more so prioritize food and actually sometimes force yourself to eat. So now I kind of think we're not necessarily on the tail end of people like just going on them for the sake of going on them. But I think we're starting to realize there's another level of
Yeah.
awareness. Like, okay, we can't just go on this for 12 weeks and then go off. There's going to be a rebound effect because you haven't worked on the root cause of anything. You
Yeah.
haven't really cleaned up and created an understanding of nutrition and what it takes to maintain those changes. So I feel like we're turning a corner now. It's never been an easy out,
Yeah.
but the masses treated it that way for a while.
But good that this is changing. So,
Yes.
but if someone now is not, let's say, it's not mandatory that someone has to get a coach, so they can just get a
No,
prescription and just do it on their own.
absolutely. Yeah.
So, so if someone has a good understanding of nutrition, they might be okay.
Yeah,
But
absolutely.
if someone doesn't have that knowledge,
Mhm.
so we probably talked about this already, but where do they go wrong? And what maybe makes them to say, that's not working, or it worked and suddenly stops working. So,
Yeah. I think where people go wrong, again, not necessarily go wrong, because I don't want to put necessarily any blame on this, but we as the world, the society, we have come, especially women, I will say, where we have really been drilled in that eating less is better and being smaller is better, and there's like the fad diets and truly the gimmicky quick fixes. And what is happening is that a lot of people aren't realizing that that's not the healthy way. So when you have those thoughts deep in your head of like eating less is better, entering a GLP-1, you're actually positively reinforcing that. And it's like, oh, I'm not hungry, sweet, and really not understand is food isn't just about fat. Food is literally fuel. Food doesn't just make you fat, right? And so it's really instilling what has been very deeply programmed in us, especially as women. And so again, I've seen that where people are like, this is awesome. I don't eat. I'm eating way less. And it's like, why are we necessarily applauding that? Eating less is necessary to lose weight, but like that positive reinforcement, it's really like it breaks my heart because that's not how it should actually be. But unfortunately, we can't be subjective in the process. So that's the first um thing that I see that people do wrong is that they're like applauding or being congratulated for not eating any food. And I'm talking under 900 calories. Like it is easy for people to be eating like very little at all. And so that's really heartbreaking. And then again, just not understanding the true negative health effects of under fueling essentially. There is um sort of dulling that food noise and having the slower digestion and the appetite suppression, but we still have to realize, oh, we still have to like maintain our tissue. We have to, and even like our organs, like our food, our protein literally helps with all of that. And so and again, I don't necessarily think that's the fault of any user. I think that's the industry and unfortunately a lot of or a lack of information by some prescribers is the reality of it. I would never expect a patient or a user who is very green and has no idea to know those things.
yeah,
That should be a professional's job to educate them.
yeah,
It's not necessarily a doctor's job to make sure it's followed through, but
yeah.
you'd be surprised how many people have come to me and said that their doctor never even talked about nutrition or exercise. And I'm just like, that's sad.
I I do have to say, often doctors they do not have a lot of nutritional knowledge.
No. And again, I don't think we should necessarily expect that, but like I feel like it is their due diligence. If you're prescribing something for weight loss to at least say you have to prioritize nutrition, you have to still work out. And this isn't a blanket statement. I've had that experience with some people where their doctors literally don't say anything. And it's like, so it's basically the bug isn't even planted, right? It's not even on their radar to be like, oh, I still need to eat. Oh, I need to have my protein. So it's just like that again, that's the gap that I'm trying to fill.
Yeah. Yeah, oh, good. So
Mhm.
what is like when they stop? Right, I mean, at some point you're eating 900 calories for like a really long
Mhm.
time. At some point you won't be losing the weight anymore. I mean, there's a system that's metabolic adaptation.
Yeah, exactly.
And but where does it go? Because 900 calories is probably for most of us um,
Mhm.
like the caloric floor.
Yeah.
So,
Oh, like,
so
yeah, absolutely. Like major caloric floor, right?
how do you get
Uh,
kind of out of it? Like, do you
mhm.
like just like traditionally reverse diet?
Yeah. And
Or
so what I've done in the past, and it's so individual specific. It depends if I've worked with them this entire time. I've had people come to me deep in their GLP-1 journey and trying to figure out like why am I not losing weight? Because that absolutely happens. And like it's an energy balance thing. And you nailed it. It's the metabolic adaptation as well, where if you're not eating that much, your energy expenditure is going down. Like your body can only go so far. And a lot of times the people that go into that higher level of dose to cause that much of like an appetite suppression might already have some metabolic issues to begin with. So that's why a lot of people, you might start to see it, peptide experts that say if your metabolic conditions aren't a little bit more optimized, it is going to exacerbate the problem. It's not going to fix the problem. It's actually going to make it worse.
okay.
And so depending on the circumstances, but like you said, I would essentially reverse them, right? And I would even consider, depending on the dose, you can also simultaneously kind of reverse the dosage to slowly decrease it, as well as slowly increasing their calories. Because obviously, the last thing we want to do is like, it's a scary thing. People, especially if they have like a lot of disordered behaviors, and it's not about getting them uncomfortable, but it is medically necessary to get them in a space where their metabolism can actually start to function and get in that positive space again. So I will kind of work both ends where it's like maybe you need to go to a microdose. I don't necessarily, again, I can't suggest like the dosage and whatnot, but I've heard podcasts where they will even cycle the dose a little bit more frequently, where it might be like 3 weeks on, 1 or 2 weeks off, just to kind of like give the body a little bit of a break in conjunction with slowly increasing your food. Like it just has to happen. There's no way around it. Otherwise, I mean, regardless if you stay on the peptide for life or not,
Yeah,
that is going to have such a rebound effect in any direction.
yeah, yeah, absolutely. Um, so would you, are there a certain type of, or like a group of people that you
Hmm.
would personally say, look, I wouldn't recommend you to go on that? That's probably
Yeah,
people who don't have a good foundation, I believe. So,
exactly.
yeah,
Yeah, 100%. And that's like I said, that's why I really encourage people to come to me before they start their peptide.
yeah,
I will never discourage. I never judge. I will never be someone that's like, you don't even need to lose weight. What are you doing? I am like, I will never judge an individual's circumstances, but I will be truthful and honest if it's like you're already not eating food. You are already only doing hit cardio workouts 5 days a week. Like this is your sleep is garbage. I mean, one of the biggest things, and not just with GLP-1s, but peptides in general, one of the biggest red flags in terms of like the efficacy of it, I guess, would
mm,
be stress and sleep. And it might not even necessarily be, I mean, nutrition and training are those as well. But I think, and like, people really underestimate the intensity that stress, especially chronic stress, can have on our bodies. And then in turn, the lack of sleep and recovery, which affects like the hormone production and like the whole function of our body on a holistic level. So if I can train people to eat properly, I can train people to out at the gym and lift heavy. But if your stress is chronically high, and your sleep is in the is in the trash, we have to work at that first because that's again, those things are just the GLP-1 is going to exasperate that.
Yeah.
So there is definitely some foundational work. And I have made those recommendations before where it's like, ooh, like I really don't know if the GLP-1 right now is the right move. Let's really do some navigating lifestyle wise for maybe like 2 or 4 or 6 weeks and then talk about it. It's not like it's a no, but there is so much that needs to be done before we bring in something like a peptide.
Yeah. I
Mhm.
believe there's a lot of mindset work to do as well, because I think
Absolutely.
when you just said like we should never judge someone, someone comes to us, to you and
Mhm.
specifically, oh, I want to lose weight, and maybe you say, so no, you don't need to lose weight because in your profession, like in your personal idea, you maybe
Yeah.
think, oh, you look good. But of course,
Yeah,
you do not know what is on in that person's brain. So,
exactly.
so we all have our own perceptions of the way
Yeah.
how we look. And I
Mhm.
think, like, especially when it comes to the end of the GLP-1, when the doctor or like you might be recommending it, or the doctor might even say, look,
Mhm.
I think we need to find an exit way.
Yeah.
Often we think maybe, what if I gain weight, or what if my physique in the mirror suddenly is changing again? I
Yeah.
think that can all really mess with us, and that
Oh,
we can get
absolutely.
right back to our old habits.
Yep.
And
Mhm.
I think like working on that mindset level would be really, really an important part.
Absolutely. I mean, you nailed it.
Mm.
It will absolutely mess with your mind. And even if it's medically necessary, if you literally suffer from the disease of obesity, it will still mess with your mind, losing the weight, hearing the compliments, the fear of gaining it back. Like it's an intense situation regardless of how much weight you need to lose. Like you said, it's messes with your mind when you start to lose it, and it messes with your mind with the idea of gaining and the fear of your body changing again. And you could get to your goal weight, but you still might not see that in the mirror. And so it definitely is like working at that self-love and compassion and giving yourself grace and also understanding that your body's still going to change. Even if you have the best case scenario, the GLP-1 worked, you got off it like it was a dream, your
Yeah,
body is still going to change. So we have to accept that like you might gain 5 or 10 pounds because of circumstances. You might lose because of circumstances. And it's like the reality is that our bodies are not necessarily meant to, but they're adaptable to that. And it's okay
yeah,
and that we don't want to start becoming reliant on these GLP-1s and coming off and then going back on and coming off. And it's like you can it is hard to maintain the changes coming off of a GLP-1, of course, because of the food noise and whatnot. But if you work hard at understanding the whys and the hows and whatnot, it is going to make the longevity of your results a
yeah.
little bit easier.
Okay. Yeah, definitely a long journey, I believe.
Yeah, absolutely, for sure.
Michelle, do you have any like coming to an end of this? Do
Yeah.
you have any like last words, recommendation for anyone who is thinking of choosing Ozempic or Mounjaro?
Yeah.
Any last words of how to navigate this if they're deciding to do it on their own? So,
Hmm.
what would you recommend?
Definitely. I
Ah,
mean, if they're going to do it on their own, whether it's physician prescribed or not, I mean, blood work is incredibly important. But really having the ability to understand how your body works, right? So, like, what is your current maintenance? Figuring out what your numbers are, looking at it black and white, right? Like, we might think in our head, oh, yeah, I might be eating this amount of food, and I think I eat enough protein, and I think I'm lifting enough. But to see it on paper or like spreadsheets, right? It's like,
Yeah.
oh, this is the gap. Oh, this is what I can work on.
Mhm.
Know what your current baseline is, so that you know when you're going too deep when being on a GLP-1. You
Yeah.
just need to know what your baseline is prior so that you can make those judgment calls. And if your maintenance, let's say, is I don't know, 2,200 calories. And all of a sudden you're on a GLP-1 and you're creeping down to like 15, 14, 1,300 calories. That should be a little bit of a red flag for you because, I mean, that's a pretty significant caloric deficit.
Yeah.
And that's almost when we're going to be concerned about that lean tissue loss and just like overall function and recovery of our body. So it's like, know where your starting point is. Don't white knuckle this process.
Yeah. So you would still recommend going for the recommended guidelines, like having the rate of loss between 0.4 and let's say
Absolutely.
1%. So you would still
Mhm.
stay with those recommended guidelines.
Yep.
Yeah.
Yeah, we don't need to nosedive it. The faster we lose the weight, the faster it's lean tissue, and the harder we will rebound because we're like, oh, sweet, we've hit our goal weight. I'm gonna go off of them. So the more aggressive, just like a regular deficit, the more aggressive out the gate you go,
Yeah.
the harder the rebound is going to be.
Yeah.
Yeah.
Absolutely. That has been interesting.
Yeah, I mean, there's so much,
Yeah,
and I hope that you've learned a little bit more and
I
that your
definitely
followers
agree.
and just opening up the conversation of like it's a non-judgmental space.
Yeah,
And if people come to you, like it's not something that we need to be concerned with. It's not a scary thing. And I'd rather have someone following these people on their journey than them just doing it on their own. So
absolutely. I totally agree. Yeah, and hopefully this can help people. Hopefully a lot of people have heard you talk and get a better understanding of everything. And
yeah,
yeah,
excellent. I hope so too.
hope so too. All right, Michelle, has been a pleasure.
Thank you so much.
You're
I really appreciate this and you bringing me on.
welcome. You're welcome.
All right.
Well, then, see you soon.
Yeah, you bet. Take care.
Bye.
Bye.